Amanda Gibson. I have been a nurse for the last 15 years. I actually worked in IHS as a nurse educator for 9 of those years in my career. And I'm currently in Oklahoma now. I'm a member of the Cherokee Nation, so I'm still getting to work with tribes and IHS across the nation here at Relias. And I'm currently working on furthering my degrees in nursing and organizational leadership. So I'm
Awesome.
very excited to learn more about you. Tell me some more about yourself.
Yes. So my name is Jonas Nguh. I am a registered nurse by training and profession, and I focus specifically in community or public health issues dealing with chronic conditions in minority and indigenous populations, which is what brought me to my role and with the organization that I work with.
All right. And what organization are you with now?
Indian Health Service, working as a diabetes nurse educator.
That's great. I know we definitely need more public health and community health in Native American communities. So I'm happy to see that you've gone so far in your role. So I do have a question. What made you decide to become a diabetic nurse educator?
Well, my background as a nurse, my background, and coming myself from a minority, ethnic minority population, we do have a high prevalence for non-communicable conditions, chronic conditions, diabetes, cardiovascular disease. So that same need is what, as I was advancing my career, led to this opportunity. Diabetes is also prevalent in my own community, family, and setting. So this translates very easily and very familiar with what I'm currently doing now to help to continue to have focus on addressing health disparities in my ethnic minority community. So when this opportunity came along, it was something that I had already been prepared for, and I've been working even with other communities to help advance. So it was an easy goal for me just to dive into this.
Yeah, obviously you saw the need early on and dove right in. So that's excellent. So I know last year you received the American Association for Men in Nursing's Daisy Health Equity Award. This award recognizes AAMN members who go above and beyond to address health equity. So, can you tell us a little bit more about why you believe you won that award and what winning that award means to you?
Yeah, well, I was nominated by a peer, which I really didn't even know about until I found out. But I think it's just a recognition, an appreciation for the work that I do. Those of us that work with this in this with these such populations and in such settings, we don't get. It's not a prestigious thing that we do to be at the forefront. We just do it at daily stuff that we do. So I really appreciate the fact that it was recognized and it was highlighted. And what I'm so grateful is that it's not just to get an award, but that award itself highlights the healthcare disparities that many of such communities face and why we need to continue to push the ball up the hill. So I think it brings more awareness generally to other healthcare professionals.
So after you found out and went through the process and everything, what are your thoughts and feelings on the Daisy Foundation itself, its leadership, and the goals of the Daisy Foundation?
Oh, I love them. As a nurse, I've been familiar. I've come across the Daisy Foundation with many of the other awards and the other things that they do. So I'm very, very familiar with them. Daisy Award is very prestigious in nursing. That is like the hallmark, and it recognizes people that are selfless, people that go above and beyond. Most of the times when we do this stuff, many nurses across all the settings, we don't get the praise, the appreciation that we deserve. So I'm so grateful that, first of all, the Daisy Award and Foundation exists because it wants to give back to those nurses who are contributing, who are pushing the agenda forward. And I'm so humbled. But the leadership it's phenomenal because they actually, coming from someone who is also a nurse, they are aware, they remain relevant to what is going on. And I think that is why this award was formed, because healthcare disparities, it's a big, big issue right now. I think the more we can continue to push that, we'll be able to close many of those gaps that exist. So thank you again, Daisy Foundation, for this.
Yes, and congratulations again on receiving that. It is a very prestigious award, especially in nursing. So I'm very familiar with that, and that is incredible. So I'd like to ask you a little bit more about the work that you do with Indian Health Service. You oversee 20 program sites across 4 states. Is that correct?
Yes, New Mexico, Arizona, Colorado, and Utah. They are like four in one block, and we have programs across all 4 states.
Why did you decide to work for Indian Health Service in the first place?
Yes, I love the mission. I love working with indigenous communities. I love that it has a lot of challenges, but I like to flip it over and say, out of those challenges comes a lot of opportunity, right? Rather than going into the big organizations, the big urban areas where everything is all done and said, and you just have to keep going through the wheel. Here, it allows you to be creative. It allows you to think not just outside the box, but to realize that there is no box, and you can actually begin to design and create your own programs. You can actually do something that is relevant to that community instead of something that is prescriptive, something that is textbook like. So, in those kinds of settings where resources are scarce, there's limitations in staff and funding and all that, you have to be creative, you have to be innovative. So for me, it was actually an opportunity for me to continue to hone my skills while I'm also serving a need. There's also a need for healthcare providers, nurses, physicians, doctors. So I love to be the place where I can be of service, I can be of value. So I saw that as an opportunity where I can help close those gaps.
As a nurse, I have to completely agree with you there. Just coming from that place of experience where you get to see the impact and the change that you're doing right in front of your eyes, it is incredibly rewarding, I believe, to work in these communities. So tell me a little bit more about the programs that you oversee.
Yeah, so we have everything uh, from patient education, where we do classes. We have other programs for screening and evaluation, against focusing on diabetes, because many of our population don't even know that they're diabetic. And if we don't screen them or evaluate them, they will not even know. The patient education are for those who are already diagnosed, and then, we help them to understand their condition and how to manage it well. Then we have programs for management and treatment where they see a healthcare provider, they go through their medications and all those. There's also community health programs where we do outreach. We do things like health fairs. We go out into the communities in their settings where patients actually live to do many of these education programs. We do training of providers itself. Just like myself, when I came over to the Navajo Nation, that was a very new environment to me. How do we train you to be culturally aware and sensitive to the population? I had to learn some of those, like how to say good morning in the language, those keywords, so I can begin to relate with my population that I'm serving. And then we also do site visits where we go to many of these sites to say, what resources do you have? What resources are you going to need? Whether personnel, whether funding, whether equipment, things like that. So it's a very holistic and comprehensive cadre of program. But we believe that doing it this way, we can more better meet the needs of our patient population. So those are just a few of the examples of the programs that we oversee.
I love the outreach activities. I think that goes a long way with people in communities, especially when they may have less access to resources like that. Speaking of resources, you've done these kind of activities, you've also created resources that you've developed for the communities as well. Is that true?
Yeah, so things like, for one, literature, the little handouts or pamphlets that you give to patients, and we want to make that it's culturally and linguistically appropriate educational material. Remember that especially in this community, language is different. You know, somebody might refer to feet or refer to their foot, but your foot and your feet is different. They might think of it different. So how do we make that language so that they understand exactly what we need rather than just reading something from a generic textbook and, oh, which part of my body is that? Or some other parts of the body might be called something different. We want to use those exact words. And we work on the information that we put on the website. Simple information, basic. We use a lot of pictures so that even for those who might not be educationally high school or above, they can still understand. We do videos, little simple illustration. Then we also have translation services. For someone like me who, when I came, I was new, how might I communicate with the patient better? Or how can the patient better understand what I was trying to say? So we have those translation services are available. So these are just some examples of the resources that we have. Because even as we want to encourage more healthcare providers to come into the IHS and into these areas, we also have to equip them with the tools that they need to be effective in their work. It doesn't make sense to have all these tons of resources, but the people using it don't understand or can't even get the message across. So we do it both ways. It is also for the population, but also for the practitioners or providers that would be tasked with delivering the services.
I want to talk a little bit more about the programs, Family Education Diabetes Series for Native Americans, the Youth Diabetes Education Facet of FEDS, and the DETS, Diabetes Education in Tribal Schools. How many people would you say have participated in the FEDS program?
Right there, we have around about 1,800 adults, round about. The last time I checked, that's where we are. I'm sure the number is up now, but the last time we got data was about 1,800. And then for the youth section of it, around about 1,400.
Wow,
Yes. Mm-hmm.
that is amazing. And I know sometimes it's a little bit more difficult to get youth involved in healthcare.
It is, yeah.
So, what would you say are some of the most popular activities through your program?
So we try to make it very community based so everyone is involved, and then intergenerational so that you might have a mom, a dad, the grandpa, the child, all the different generation. But things such as the cooking classes, which is a really, really love. We teach them how to cook food that is still relevant and within their culture, but it incorporates nutritional, basics, calorie watching, less sugar, and all those things. We have that. Then exercise and weight management, and we make it fun so that it is not something like you have to do all these things extra, but how can you incorporate exercise and weight management in your daily life as you go along? So it's not like an additional burden to put on you. We have do that. Then nutrition education. This is where we have many of those videos and all that. And we do this in a weekly basis. So if you can't come this week, no problem. You can come next week or the very next week. So it's very laid back. It's easy. You don't feel overwhelmed, but it's fun activity. And by the time oh my God, I've gained all this information without even realizing that I was learning along the way. I just felt like something I was doing for fun. So we try. That's how we've designed it, or at least we incorporate it. And then once a month or quarterly, we'll bring somebody as an outside speaker to come in to speak. Somebody that understands the culture, but from their own lived experience, they can speak. And we found that that is really, really important because people can relate when they see somebody that looks like them or has gone through a similar experience that they too are going through, and they can actually begin to see someone that has that's having a positive outcomes.
Yes, I think that's really important. I love that you do that and bring in the outside speakers as well. So you discussed cooking classes. I love that idea. I think that a lot of people could really benefit from that, even if they're not dealing with diabetes or managing diabetes. And you've got them exercising without realizing they're learning, and that's amazing.
Yes.
Are there other specific important messaging that you include with your programs that you really want to um, raise awareness within the communities on?
Yeah, I think overall message is just that we don't frame that, we don't use the word as a disease. We frame it instead from the side that how can you improve the quality of your life? How can you improve, your health generally for yourself, your children, your family, and when you can relate it to something tangible, it make people begin to hold on to that. Let me live long so I can see my grandchildren graduate. Let me do better so I can see my daughter get wedded, so I don't have to go into the hospital. So we try to frame it in a positive way so that they look at the positive thing. Because as you and I know, diabetes is a life long condition. But we tell them that with proper management and with these easy things that you can just do in your day to day life, you can live better, you can live longer, and you can live a much positive life. So we stay away from the word as a disease, as a condition. We don't use that word in a framing. Not that it is, but in order to make people more engaged in it, even without realizing it, we change the narrative of how we communicate with our patients. And we just want them to know that the overall message is that with simple lifestyle changes, you can live a better quality of life.
I love that messaging and really taking away the negative connotation and message around it, probably reducing some feelings of shame or, things like that. So would you say that with that kind of flipping the script and changing the messaging to a more positive message, do you think that that has created more success in managing diabetes throughout
Oh,
Indian
very,
country?
very much so. Very much so. I see that. Begin again with one. When you're coming from a minority community and the first time you meet a healthcare provider, they're already putting all this stuff on you. It's easy for people to give up. It's easy for people, well, I have it. Okay, what am I going to do? What else is there? So we want to stay away from those kind and then have like focus on those motivations or incentives that people can see. And some of the things I've seen is that as student population, the participation has increased. I think it's almost like doubled for the number of students that want to participate because it's fun, it's lively, they love it, and they don't think of it as anything additional. Then even with our youth, behavioral changes. When they go to the canteens or when you go to the lunch line, they are picking up healthier choices. We can say that, and you don't need research to tell you that when students on their own would want vegetables, so stay away from processed foods, all those kind of things. We're already seeing that attendance at the sessions and the classes are increasing. So you know that the message is getting across. People are coming willingly out of their own accord. And then healthcare outcomes are actually also improving where when they come in for either their monthly or quarterly evaluation with the providers, those that participate in the programs, think measurements like their weight is coming down, A1C, many of them are dropping, and those that have dropped are staying within normal limits. They are feeling much better on themselves. There's also research about diabetes and depression, and we're seeing that there's people have much more of a positive outlook because now they are in control. Now they know that they can do something about it, and they take charge in their own health. So it's sort of like reinforcement, everything that we are doing to give them back that power that they can improve their own lives. We are just there as the tool to help them, but they take charge and they see those outcomes and they become, those depression, it lifts up. So we're actually seeing evidence of what we're doing and how it is working.
Will you explain to me what is the citizen healthcare model?
Yes. So this is a model that, when you go to the doctor and It's sort of like a one-way process. The door, oh, this is where you are, this is what you have, this, that, and that's it. Take this pill and that. You don't have no, it's like, oh, it's just a one-way process. With the citizen healthcare model, it engages the patient so that you as a patient, you're also a participant in your own health. But beyond you, just that one patient, this model goes beyond that to engage the community. And this is where, with many of the programs and services where we have, community is very, very key into it. So that not just engaging the patients, but the entire community as co-producers of health and healthcare. So from an activated patient, we now come to an activated community. If you have, let's say your community is your neighborhood or your school or wherever you live or you function, if everyone is involved, we support each other. We take accountability for each other. And then you don't feel like, oh, I'm the only one in this. Let's say my whole name, oh, I'm the only one with diabetes. And look at my friends out there playing. Oh, I can't get to eat a salad. I can't get to go here because I have this. So everybody wraps their hands around everyone. We work together, we lift each other, and you don't feel so isolated, And even with ownership and accountability, we look out for each other. Research has shown that when just like we exercise, if you have a group of friends where we all go to exercise together, oh, people feel much better because that stigma is lifted. Then people hold each other accountable. People support each other and all that. So it's that same kind of model where it's a community-based activity, accountability, resources are shared, knowledge is shared and all that. Because we didn't just want to focus on the individual aspect. Then people might slide off, people might not come and all that. By it being a community thing and people can do it together, it becomes fun. And that stigma is removed from it. So that's how this citizen model was developed from.
I love that model. I definitely feel that with that sort of healthcare model, people probably are a lot more supported. Having a whole entire community having their back, that's amazing. So, what are some of the promising feds and debts outcomes to date?
Ooh, let's see. So we've had increase in participation to attending many of those programs. We're seeing that um, when people go for their weekly or quarterly check-ins, we're seeing many of their measurements come down or stay within limit. We're seeing that, which is good. We're getting a very more inquiry about the programs. And when you start having people call, like the phone lines, you're getting more call, it means that you're doing something good. Many more people, because the other ones are telling their friends and families about it. We're seeing that. So overall, we are getting really, really good outcomes. Behavioral change. We're seeing people making better food choices, staying away from processed foods, going more with healthy organic foods, even though that might be expensive compared to buying something in a can. But I think people are taking ownership for their own health. And that's you can't beat that. When people take ownership, that's something that you cannot put a price on. So I'm so glad that we're seeing movement that is being made. It takes having the practitioners and the clinicians to do, but it also takes the population being aware and then making those lifestyle changes. While we need resources and we need all these programs and services, if the people are not engaged, it's not going to be there will be no impact. Or if you put all these things there and the people don't believe your message or it's not relatable to them, they're still not going to do anything. And that's one of the things in our program is that our messaging is key. Our message is culturally sensitive. It meets them where they are. So if we do not work in tangent and address all these things, the problem is going to still be there. So we look at it from all the different facets to make sure that we are pushing the ball up the hill. Unfortunately, it is something where you cannot fix overnight. It's going to take years and years. But we're hoping that as with each generation, maybe we're starting now, the next generation coming up would begin to identify that, oh, this is an issue. Let me do things differently. So we are just starting. But like with anything, you have to start from somewhere. There has to be a starting point.
Yes, and that's what I was thinking is that we didn't get where we are overnight. So it's
Know where we, yes.
yes. So this
Yes.
is where that citizen healthcare model really can come into play to support the entire community with the community members and the clinicians as well. So I'm switching gears a little bit with a few final questions and thoughts overall. How do you feel about being a nurse and what you've been able to accomplish in your career so far?
I love nursing. I think for those of us, just like people that teach, those of us that do this kind of work, it is because you're passionate about it. As we all know, nurses and teachers they are not millionaires. And you don't go into it to get rich. You get into it because you want to make an impact. You want to make a
Mhm.
difference. And being in nursing 28 plus years now, I just love it. I wouldn't have stayed this long if I really didn't love it. So it's one of those things that you're either born with it, So I just love the work that we do, and the fact that we actually impact people's lives. You can see the change that we are making.
Absolutely. So, last thought here. Is there any advice that you would impart to other nursing professionals?
Uh Wow. Oh my God. I don't even know where to start. I think especially when I tie it back to it, minority communities or healthcare disparities, is that I think the call is for all of us, even within your own setting or wherever you work or the community you take care of, find one thing where there's a deficiency or there's a gap and begin to work to address or improve that. I think as nurses, we're all charged to maybe with our family members, our friends, help our communities to better improve their life, the quality of their lives, their decision making, their health care. I think if we all do one thing, or each of us, we do one thing every day, we can help to develop a healthier nation or improve the quality of healthcare for all of us around us. I just work in one area dealing with a number of patients, but imagine if every single nurse could be doing this every single day, then we'll make a huge, huge impact that would improve our healthcare. So I think that's the one thing that I would say for every single nurse to find one thing that they can do every day to better the lives of someone or the patients that they serve.